If you're struggling with fatigue, weight gain, or brain fog, despite being on thyroid medication, you may not be on the right medication. In this video, I'm going to break down the differences between thyroid hormone replacement so that you can figure out whether you're on the right one. Keep in mind that thyroid hormone replacement is not the way that we treat Hashimoto's. Welcome back to the Red River Health and Wellness channel, where I help you decode your blood work so that we can approach your disease from a root cause perspective. My name is Dr. Arts, and today we're diving into why having the right thyroid medication can make all the difference in your symptoms. First, let's talk about the different kinds of thyroid medications. One of the most commonly prescribed thyroid hormone replacement is called levothyroxine, or T4. Another brand name for this might be Levoxyl or Synthroid. T4 is actually an inactive thyroid hormone that is stimulated by your brain hormone called TSH. Your brain tells your thyroid to produce T4, and then T4 has to get converted into T3. You may be asking, well, then why don't we just prescribe T3? That's a great question. T3 is so metabolically active in your body, it only has a half-life of about 4 hours, that if we were to just give you T3, we'd have to dose it multiple times throughout the day. It's better to let your body make that conversion and that decision itself, as your body will create more active thyroid hormone based on need throughout the day. That doesn't mean that we don't give T3, and many times we're prescribing for a patient T4 and T3 at the same time. Now, the most common brand names you may hear for T4, like Synthroid and Levoxyl, or T3, like Cytomel, if they're coming from a regular pharmacy, chances are they're not bioidentical. These are synthetic hormones. If you wanted to go the bioidentical route, we have a couple of options that are generally covered by insurance without having to go to a compounding pharmacy. These options include things like NP thyroid and Armour thyroid, also known as desiccated thyroid. Kind of a fun fact about the Armour company. The Armour company was actually founded in the mid-1800s in Chicago, and it was a meatpacking company. They discovered that they could desiccate or break down the organs of the cows and the pigs that they were processing and put them into capsule form and use them as supplements. They did this with things like the thymus gland and the adrenal glands, and eventually they figured out that they could do it with the thyroid gland as well. So Armour is desiccated bovine thyroid, which means it's a cow's thyroid that has been dried out, broken down, and put into supplement form. This does count as a bioidentical version of the hormone. Armour thyroid or NP thyroid both come with T4 and T3 because naturally that's what our thyroid has in it. That means that we don't have to rely as much on your body to make that conversion, but we may still need to dose you multiple times throughout the day with a little bit of extra T3. Choosing the right thyroid medication for you depends on a multitude of factors. For example, is your body naturally able to convert T4 to T3? You may be asking yourself, well, how would I know that? When you look at your blood work, has your doctor ran the full spectrum of thyroid hormones? In other words, have we checked the entire feedback loop from your brain to your target tissues, which is basically every cell of the body? In order to do that, we need to be looking at TSH, T4, T3, which gets converted out in the periphery. And we also need to be looking at what is your body's ability to reverse T3? Is it doing that in too high of a quantity? In which case you may feel very hypothyroid, even though you have plenty of T3 hormone. And what is your T3 uptake looking like? In other words, are those receptors blocked by something, like high estrogen, for example, which happens a lot in insulin-resistant patients? We talk about autoimmunity in depth in many of my other videos, so I won't go too far into that now, but what's really important to know is that just replacing your thyroid hormone may not be enough to get symptomatic improvement if you are dealing with an autoimmune condition like Hashimoto's or Graves' disease. Today, we're just going to address how thyroid hormone can help get you out of a hypothyroid situation. I want to note, it's really important not to chase lab values when we're prescribing medication. The body will go through hypo and hyper swings when it has something like Hashimoto's or Graves' disease. If we're constantly chasing lab values, in other words, if we're constantly increasing or decreasing your thyroid medication just based on what we see on your blood work, most of the time we're going to be doing your body a disservice, and we can actually cause a hypo or hyper swing. It's important to give that medication at least 8 or 12 weeks to stabilize in your body before we make any changes, especially if symptomatically you're feeling great. You may have told your doctor multiple times that you don't feel well despite being on the right dose of medication, at least according to your physician. This happens a lot where I'll have patients coming in saying, I was on a higher dose of my thyroid medication and I felt really good, but my doctor didn't like what the lab values looked like, so he made me jump back down. One of the reasons you may be feeling better on a higher dose of medication is because of a conversion issue. So let's talk about the conversion of T4 to T3 and why T4 may not be the only or the right medication for you and your body. Most physicians are doling out levothyroxine or T4 to patients who have Hashimoto's or hypothyroidism. One of the dangers in just looking at the TSH value or even just T4 when we're evaluating the correct dose of medication for a patient is we miss the fact that there has to be some kind of conversion from T4 to T3. We can give you all of the T4 medication in the world, but if your body, genetically or otherwise, has an inability to make that conversion, you are still going to feel all of those hypothyroid symptoms. Insurance companies like to call this subclinical hypothyroidism, although as a physician, it's actually pretty hard to prove to the companies that you deserve to be on a better medication. Most of the time, physicians won't even bother, and so instead they just increase your T4 medication, unless of course your TSH looks like it's too low, and then they'll just drop you back down regardless of how you feel. That's why it's so important to make sure we're testing all along that feedback loop so that we can see what your ability is to convert T4 to T3. So what are some of the things that are required to convert T4 to T3? Nutritional deficiencies can absolutely cause an inefficient conversion of T4 to T3. What's kind of interesting is this could have been caused by a malabsorption issue, which most of the time is actually caused by having low T3 in the first place. So it's kind of a chicken or an egg situation. Do I have malabsorption and nutritional deficiencies because I don't have enough T3? Or do I have low T3 because I have malabsorption and nutritional deficiencies? That's why it's so important to look at the body as a whole. How do we treat and support your system so that you respond to the medication appropriately? We can correct malabsorption and nutritional deficiencies by temporarily giving you a little dose of an active T3 hormone. Then we can see how your body is able to retain its own nutrients and make those conversions on its own. I love to add T3 into my patients whose T3 values are looking lower than 100. That's a pretty conservative thing to do because eventually our plan is to get off of that T3 medication and let your body do its own thing. Other things that are required to convert T4 to T3, there are enzymes that are encoded in your DNA to make that conversion. One enzyme is called thyroid peroxidase. Thyroid peroxidase's job is to take an iodine molecule off of T4 so that it can become T3. That's actually the only difference between T4 and T3 is one iodine molecule. This is why it's so important for patients who have Hashimoto's. Because you're creating an antibody response against thyroid peroxidase, we don't want you taking high doses of iodine. One of the most common misconceptions is that everyone who has hypothyroidism must be iodine deficient. It's actually not usually the case, especially for my Hashimoto's patients. Hashimoto's patients should not take high doses of iodine, anything over 100 micrograms, because that can actually induce an inflammatory response. It can cause your antibodies to attack thyroid peroxidase even more than it was before, since thyroid peroxidase's whole job is to remove iodine from T4 and convert it into T3. If we give you too much iodine, we're really just adding fuel to the fire. Most of our T3 gets taken up by the cells of most of your organs and is converted to something called free T3. Now, your physician may actually be testing for free T3, so I want to make a note here about why that's not a very helpful value. When we test thyroid hormones, we test free T4 and total T3. Every once in a while, I'll look at a free T3 if I'm really curious about what a patient's organs are able to do with that hormone. However, most free T3 is inside of your cells, so it's actually not something that we can test for accurately in your blood. T3 values also vary throughout the day, so if you are getting your blood work done, make sure you're choosing the same time of day to do that. Now, there can be some roadblocks with that peripheral conversion of T4 to T3 or from T3 to free T3, and those roadblocks could be occurring in the organs themselves. That's why, again, it's so important that we take a holistic view of your body. How is everything functioning? We can't just throw a hormone or even a supplement on top of a body that isn't functioning appropriately. If you're taking T4, like levothyroxine, Thyroid, or Levoxyl, and you're still feeling like you're hypothyroid, that may be entirely due to the fact that your body is inefficient at converting T4 to T3, and as long as you don't have enough active hormone, T3, you are going to feel all of the hypothyroid symptoms. Now, it's important to distinguish what's a hypothyroid symptom and what's an autoimmune symptom. Hypothyroid symptoms are going to feel more like brain fog, fatigue, constipation. Autoimmune symptoms are going to feel a little bit more like joint pain, muscle aches, flaring, water retention. You may notice that you go through weeks at a time where you really don't feel well and those symptoms are a little bit exacerbated, and then you go into kind of a remissive state where you're feeling a little bit better. That generally does not happen if you have a pure hypothyroidism. What that means is you have hypothyroidism that is not related to an autoimmune condition. The only way you end up hypothyroid with an autoimmune condition like Hashimoto's is because of the inflammation that destroys thyroid tissue. With someone who has primary hypothyroidism, in other words, not caused by an autoimmune disease, those conditions, those symptoms are going to feel a little bit different and they shouldn't fluctuate. As soon as we're able to get you replaced with an adequate amount of thyroid hormone, you should feel great. So what are the reasons why we don't want to chase lab values? In other words, why don't we want to just look at something like TSH or just look at something like free T4 and then adjust your medication based on the values of those things? Well, first and foremost, lab reference ranges are not normal ranges. Lab reference ranges are averages based on the patients who are going into the lab. If most of the patients going into the lab have hypothyroidism, that's going to throw off the average, right? The reference interval. So first and foremost, one of the reasons why patients can feel under-replaced with their thyroid hormone is because their physicians are using those reference ranges as normal or functional ranges, and that's not the case. Another reason we don't chase lab values, in other words, if your TSH looks really low on your blood work and your doctor wants to back off your medication, one of the reasons we don't do that is we can actually throw you into a hypothyroid flare if we don't know what's going on. So in other words, are you in some kind of autoimmune flare, in which case we would never want to make immediate changes to your medication until you've kind of evened out. You may have something like Graves' disease. You may be stuck in a hyperthyroid flare and they want to give you some medications to reduce that flaring. And then you end up going into a hypothyroid state because we suppressed your thyroid too much. There are ways to support a patient getting out of a flare that have nothing to do with adjusting their hormones. Now, if you don't have autoimmunity and you just have something like hypothyroidism, in that case, what we want to do is make slow, steady changes to your hormones until we notice not only that you feel better, but that your lab values jive with what's an actual healthy or functional range. Now, I had mentioned that I want to see your T3 over 100. Really, what I want to see is a one-to-one conversion of T4 to T3. So your T4 on your blood work may look something like 1.14. I would expect then to see your total T3 somewhere around 114. That's a pretty easy way to make a one-to-one conversion. Now, if your T3 is just a little bit lower than that, that's okay. As long as we're getting above 100, your body should be happy, but different patients also feel better or worse on different doses of their medications. If you do end up having a low T3, we're going to want to dose you with an extra bit of T3 hormone multiple times throughout the day. Usually I start with the morning dose of about 5 micrograms with your T4 medication if you're taking it, and then I have you take another 5 microgram dose sometime between 12 and 2 in the afternoon. Your body naturally isn't converting or creating a whole lot of T3 hormone at the end of the day, so I usually avoid having patients dose towards bedtime. Some symptoms to watch out for if you are over-replaced on your medication, in other words, if you've been thrown into a hyperthyroid situation, you may be noticing that you have some increased anxiety, heart palpitations, your respiration rate may have increased, you may see insomnia, diarrhea is a really common symptom as well, sweating excessively from your hands, from under your arms. All of those are things that indicate we have kind of a hyperactive system. Thyroid hormone, remember, it's responsible for metabolism, not just metabolism in the sense of how quickly you burn calories. It is responsible for that, which is why a lot of people who are hypo experience weight gain and a lot of people who are hyper experience weight loss. But it's also responsible for cell metabolism in the sense that your cells of your organs require T3 hormone in order to do their job. One of the main things that T3 hormone is responsible for is actually for maintaining the integrity of your colon. When we talk about having food sensitivities, especially if they're becoming a little bit more unpredictable, when we talk about having malabsorption issues, or maybe you're experiencing a lot of bloating or gas, those are usually signs that we could use a little extra metabolism in our enterocytes, the cells that line our colon. T3 hormone is taken up by those cells and it stimulates those cells to produce mucus. That mucosal layer on the inside of your colon is what protects the cells underneath and allows for an exchange of nutrients. You can imagine if you don't have enough T3 hormone, that is going to result in a lot of gut issues because that mucosal layer will not get regenerated and you're going to experience a lot of irritation and swelling and inflammation of your colon, which eventually leads to things like malabsorption and then leaky gut. My advice for you is don't settle for just feeling okay. If you have questions about your blood work, if you want to know whether your physician is actually running the correct hormones, don't let them tell you, I've got it. Make sure that you advocate for yourself, write down the tests that you want to have done, and if all else fails, fire your doctor and get a better one. Even though levothyroxine or T4 is one of the most prescribed medications for patients who have hypothyroidism and Hashimoto's, doesn't mean that it's the right one. When you go to medical school, traditional medical school, usually what they teach you is, here's this medication for this condition, or this medication for this symptom, or when you see this on labs, you're going to give them this medication. There is not a whole lot of critical thinking that happens there. They're not looking at the body as a whole. Your endocrinologist doesn't really care what your cardiologist is doing, doesn't care what your rheumatologist is doing. You could be on conflicting medications, ones that are actually affecting absorption of your hormones. So it's important that you advocate for yourself when it comes to well-rounded care. Levothyroxine is not the right choice for everyone. In fact, I would say the majority of my patients require much more than just levothyroxine. And some of them do a lot better on a desiccated thyroid, which is a natural bioidentical thyroid versus a synthetic. Your thyroid journey, just like you, is unique, which means it requires a unique treatment. Speaking of finding the right hormone treatment for you, I've created a free guide that breaks down all of the different kinds of thyroid medications that are available, including compounded versions of thyroid hormones that you can download now in the link below. At Red River Health and Wellness, we focus on specialized thyroid care so that you can get the help that you deserve. From advanced testing to holistic treatment plans, we're here to support you every step of the way. Click the link below to schedule a consultation with us today. If you enjoyed this video, make sure to click on the next one where I go over the signs and symptoms that you may be on the wrong thyroid medication or the wrong dose of your medication. Click the video on your screen now. I want you to remember that your body is unique, which means your health journey is going to be unique too. There is so much information out there and it can feel very overwhelming. Should I eat this food? Should I take this supplement? One of the things that we can help you do is come up with a unique treatment plan so that you're getting the health that you deserve and really getting to the root cause of the dis-ease in your body. Stay empowered, keep moving forward. You've got this.